Hello and welcome to my channel. Today our topic of discussion is about overview of heart murmurs. In this video, we will be looking at what is a murmur, types of murmur and important criteria when describing heart murmurs in exam. In exams regarding murmurs, questions that can be asked are usually the causes of murmur and how to describe a murmur. Without further wasting time, let us go into the video. A murmur is a whooshing or swishing sound heard through a stethoscope when blood flows abnormally over heart valves. Being said that, murmur is a clinical sign that shows a disease that is lurking behind. There are different types of murmurs, which are systolic murmurs, diastolic murmurs, continuous murmurs, and innocent murmurs. Systolic murmurs are murmurs that occur during the heart's contraction or systole phase. Systolic murmurs can be further classified into ejection systolic murmurs and pansystolic murmurs. Ejection systolic murmurs occur in the middle of the systole when blood is ejected from the heart. Examples of conditions that can cause ejection systolic murmurs are like aortic stenosis or pulmonary stenosis. Pansystolic murmur occurs throughout the systole. They happen when blood escapes uniformly or continuously from a ventricle into a low-pressure chamber. Some causes of pansystolic murmur are mitral regurgitation, tricuspid regurgitation, and ventricular septal defect. Diastolic murmurs are murmurs that occur during a diastole phase. Diastolic murmurs are low-pitched noises that are often difficult to hear. Do not be frustrated if you are unable to hear it. Usually, you need to be very experienced in hearing heart murmurs to hear diastolic murmurs. Diastolic murmur is also classified into types like a mid-diastolic murmur and early diastolic murmur. As the name suggests, mid-diastolic murmur occurs in the middle phase of a heart diastole. The causes of mid-diastolic murmur may be due to mitral stenosis, tricuspid stenosis, or increased flow across the mitral valve or increased flow across the tricuspid valve. An early diastolic murmur, on the other hand, occurs in the early phase of heart diastole. Some causes of early diastolic murmurs are aortic or pulmonary regurgitation. Continuous murmurs are murmurs that occur throughout both the systolic and diastolic phases of the heartbeat. An example of a continuous murmur is due to a persistent ductus arteriosus. Continuous murmurs must be distinguished from extracardiac noises such as bruits from arterial shunts, venous hums, and pericardial friction rubs. The last type is innocent murmur. These are harmless murmurs that do not indicate any underlying heart problems. Innocent murmurs are typically heard in children and young adults and tend to disappear with age. Next, we will look at the important criteria when assessing a murmur. These are important points that need to be mentioned to the examiner when you are describing a murmur. The first thing that you need to assess is the duration of the murmur. What I mean by that? The meaning is you need to time the murmur using heart sounds, carotid pulse and the apex beat, and ask yourself, is it systolic, diastolic, or does the murmur extend throughout systole or diastole? The second thing that you need to assess is the loudness of the murmur. The loudness of a murmur is described in terms of grades. Systolic murmur is graded from 1 to 6, whereas diastolic murmurs are graded from 1 to 4. The third is the location of the murmur, which is heard best. You need to listen over the apex and base of the heart, including the aortic and pulmonary areas. The fourth thing to assess is the radiation of the murmur. For example, a mitral regurgitation murmur radiates to the left axilla. I remember a mitral regurgitation case was given to me in my third year as a medical student. The examiner asked me to describe the murmur I heard. I will give you a sample answer. It goes like this: I heard a pansystolic murmur at the apex area and it radiates to the left axilla. I would grade the murmur as grade 3 as no thrill was present. This is a mitral regurgitation murmur. Of course, this is a very basic answer that can make you to pass the murmur question. You can add associated features when describing a murmur to get extra marks. Comment down below if you thought of any important description of murmur. These are the key points that you must know regarding heart murmurs. A murmur is a whooshing or swishing sound heard through a stethoscope when blood flows abnormally over heart valves. There are different types of murmurs, which are systolic murmurs, diastolic murmurs, continuous murmurs, and innocent murmurs. Systolic murmurs are murmurs that occur during the heart's contraction or systole phase and are classified into ejection systolic murmurs and pansystolic murmurs. Diastolic murmur occur during a heart diastole and are classified into mid-diastolic murmur and early diastolic murmur. Continuous murmurs are murmurs that occur throughout both the systolic and diastolic phases of the heartbeat. Innocent murmurs are harmless murmurs that do not indicate any underlying heart problems and are typically heard in children and young adults. Important points to remember when describing a murmur is the duration of the murmur, loudness of the murmur, the location of the murmur which is heard best, and finally the radiation of the murmur. That's all for this video. As usual, please give a thumbs up, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.